My previous speaker has said that it's a very big topic. We don't know where to start and where to end. But I have been given the responsibility of confining myself to 5 words. These are medical errors, medical malpractice, medical negligence, current trends and the issues. The medical errors, I'll just start with this small example. I had a good friend, very conscientious and diligent surgeon. A patient was referred to me with a diagnosis of adenocarcinoma of the stomach. He advised him surgery appropriately. When the patient was down, operation table, he opened the stomach, he found no cancer. He was confused what to do. He was a very diligent surgeon, I have told him. He came out of the OD, went to the lab, discussed with the senior most histopathologist, took out the slides, had a look on it through a microscope, along with the pathologist. Yes, there is no doubt it is adenocarcinoma of the stomach. He had no way out but to take out the stomach. He did a subtotal gastrectomy, sent the specimen for serial sections. Patient was discharged uneventfully. After 15 days, when the pathology report came from the stomach he had removed, there was no cancer. There was no cancer. He called up the patient to inform, I have 2 news for you. One is a good news, because you don't have cancer. The other is a bad news. I removed your stomach, today there was no cancer. This is a classic example of medical error. Medical error means these are preventable adverse events of our care that we give to our patient. And when the matter was inquired, beyond these slides, it was found that the technician made an error in leveling the slides. So a non-cancerous patient slide became a cancer slide, and a cancer patient was treated as a non-cancer. These are preventable errors. These are preventable adverse effects of our care. Then coming to the medical malpractice, a couple who had just started their life, conjugal life, was waiting for the first baby to come to this world. She was in labor. The uterine contraction was weak. So the obstetrician thought, I'll push her a dose of oxytocin. Uterus started contracting. The baby was delivered. But subsequently, the baby had anoxic brain damage. He lived with a life of cerebral palsy, remaining dependent on others. The problem was, when a lady is delivered, there should be a fetal heart monitor. It's a standard practice. The baby went into fetal distress because she had prolonged labor. Her uterine contraction was weak, but no monitor was connected to the baby patient. As a result, we had an experience. We had an experience which is bad for the whole life. This is nothing but medical malpractice. It's a standard practice that you should have a fetal heart monitoring when you are conducting a labor. And when this patient is coming to you for delivery, and when you are taking money from her. This is medical malpractice. And what is medical negligence? There was a young man came to a doctor with road traffic accident. He had bruising in the scalp, he had bruising in the chest, he had bruises in the leg. It's a polytrauma patient. He was vomiting, he had terrible headache. The scan showed a cerebral contusion. He was treated, he recovered, he was discharged home. Came for a checkup after 15 days. Doctor asked him, do you have headache? Do you have vomiting? Do you have seizures pain? He said, no, I am fine. He said, my leg keeps paining. He said, oh, this will also go, don't worry. It's going to disappear. These are post-traumatic pain. You had some injury. He did not improve. Every time he starts working, his pain increases. This time he sends his doctor, went to another one. First thing he did is an X-ray of the foot. There was a fracture of the metatarsal bone, which was missed. This is medical negligence. Should have been done. He did not want to harm the patient, but he did not do it. This is medical negligence. Irrespective of whether it is medical negligence, medical error, or medical malpractice, it harms my patient. It harms a human being. It's important. What is healthcare? Healthcare is one human being taking care of another human being. In one side, the one human being is the doctor, the nurse, and the therapist. The other human being is the public. I can also be a patient sometimes. I should be treated as a human being, not as a merely guest. Because of this, there was a very important landmark paper written by one of our Indian fellow professional colleagues, Ashish Jha, who is working in Harvard School of Public Health, which was published in British Medical Journal. You can all go through it. You'll find that globally, 43 million people suffered injuries of different degrees because of either medical error, either medical malpractice, or because of medical negligence. For some of them, this can be temporary, physical, financial, or psychological injury. For some, it can be permanent. For some, it can cost their lives. It's not easy. In USA, every year, 98,000 people die just because of medical error, medical malpractice, and medical negligence. In India, the same paper says 5.2 million people suffer injury of different kinds, either because of any of these three things. When we treat patients, when you come to that, I was trying to extrapolate that figure into the Northeast and then Assam. What I found out in Northeast, every day 500 people suffer medical different kinds of injury, including that every day in the Northeast because of these three Ds. If you come to Assam, every day 300 people suffer medically different kinds of injury, temporary, permanent, or it can cost their life every day. Then I was trying to find out, is the society so much cruel to us? Are they so much intolerant to us? Is it the right thing? I was trying to analyze the US data. Then US is a very alike population, very, very little generous. You go to the court even for small, slightest pretext. We keep on hearing stories that when a patient is discharged from the hospital, the ambulance is followed by a group of attorneys and go to the family and say, give us the paper, we want to go through it. And if there is something, we file a malpractice suit against the hospital and the doctor. You don't have to pay for it. We'll share whatever compensation will come. We keep on hearing this story, but are they lying? Is it a true picture? In a country where 98,000 people die just because of medical error, medical malpractice and medical negligence, only 8,000 lawsuits are filed for medical malpractice. Yeah, do it. 18,000. Against 98,000 deaths, there would be many more. out of every 250 people in this world, in their lifetime, one suffers because of medical negligence, medical error and medical malpractice. 1 out of 250. So 550 million population of USA, you can imagine what would be the number of patients harmed by this kind of care that we are providing to the people. I am not blaming my medical community. Then I blame myself. We are good people but victim of a bad system, which my colleague Alex will speak probably more elaborate. We are victims of a wrong system. We spend very little time in correcting the system. For every 25 patients that you treat, in 1 patient it goes wrong. When I see 25 patients in my OPD clinic, when I reflect on them, taking a little pause, then I find that there was few patients I did not take the history properly. There was 1 or 2 patients whom I could have examined in a different way. There was 1 or 2 patients whom I could have planned my treatment in a different way. Could have been better. If that happens, even after so many years of experience, you can evaluate it. But it can happen. Out of every 25 patients that we treat or see, be it in OPD or in indoor, be it in a hospital or outside, 1 goes wrong. We should not say no. But look at the aviation industry. After every 3 million flights, 1 meets with accident. Because it's also a very complex industry. My fellow speaker said, hospital is a complex workplace. And that is so also aircraft, flying in aircraft. The doctors behave like pilot. They hardly talk with the ground force. How many doctors during their round discuss the patient's problem with the nurses? We give order, we expect them to execute the order mechanically. Especially in this country, I have not been able to introduce the system of discussing the patient's problem with the nurses who stays with the patient most of the time. How much time I give for my patient? Not more than 10 minutes a day. My sister remains with the patient for 24 hours. How much time we have given to this them to bring them up? Not much. If you look at the nuclear industry, after every 6 million activities, 1 go wrong. But in healthcare, after every 25 activities, 1 go wrong. We are all part of that system. We cannot say no. So, in USA, after having so many mistakes to the people, it's 1 human being. Today I am a doctor, tomorrow I can be a patient. My children can be patient. Have you ever thought what kind of treatment I would expect from my patient at the hospital when my DN and DA1 and my children are sick? Do I try to give the same thing to another patient who comes to me for their care? These are important things. If we analyze why people go for medical malpractice suites, you know what is the most common reason? You know what is the most common reason? We did not follow the fundamental principles of patient care. What we learned in a third year medicine? Something has changed over a period of time, but not much. What my teacher taught me when I was a third year medical student, the basic approach to medicine with so much of technology has not changed. That's what I feel personally. Please listen to the patient, examine him, explain him, and let God. Do we do that? In USA, well-designed studies has proved that after 17 seconds, you jump over the patient and say that he starts talking, not the patient. He has no right to listen to the patient. We don't do that. Many flaws happen because we did not examine the patient properly. Many of the malpractice suites comes because we did not explain honestly and sincerely. I'm using the word honestly. We tell them only things which I have. We do not tell them something which they can avail, which I don't have, but someone else can have. I remember it. The paragraph which was coined by someone. Say, you buy mango from particular person. You go to his shop one day and he tells you that, child, you don't buy mango from me today. Why? My mangoes are not good, they are sour, they won't be that sweet. You buy from someone else. What you have, you'll always feel that this is a trustworthy man. Whenever I need something, I always come to him only. But it does not have healthcare. We don't tell the patient who is better than me. We always say that I am best. I have everything for you. And those are the kind of things, the environment that we are creating, that destroys the doctor-patient relationship, that destroys the trust of the people on the doctors. We were at one time regarded as a God. They no longer treat us as God. Conflict with us also. Not only with the conflict. We are part of the society. So it's both way, not in one way. When it was analyzed, that what are the causes, top 10 causes for which people becomes angry with doctors in the hospital. You know what is the number one cause? History was not taken properly. History was not taken. Many informations were not asked. Family history, personal history, the records of first treatment, doctor, nobody. Go to the histories written by no hospital, any hospital. Whether it is a teaching hospital or a private hospital. The most common cause, the topmost cause is adequate information were not collected from the patient. Number one. Number two, the informed consent was not taken properly. Why? Each and every surgical procedure is different. The risk of each and every surgical procedure is different. We have a type consent form and we ask the patient to sign without explaining him why he should sign. I tell you as a patient my experience. My wife had a hernia. Then I thought that I'll take her to Delhi and get it done there. The reason was, my eldest daughter, when she was born, I was a senior resident in All India Institute of Medical Science. The gynecologist is still practicing. We had an emotional relationship with her as a teacher, as a very good doctor. So I took my wife to her. She was conducting her delivery. I said, let's let her do it. I went to her. She called another surgeon for her operation. The surgeon who was supposed to operate on my wife never had any discussion with me. What operation he is going to do? What will be the complications? What is the chances of success? He never discussed. Then at 10 o'clock I was given a bunch of paper to sign. Sister said, "Ye aapko sign karna padega." She did not know that I am a doctor, what my background is. Okay, sister, give me the papers. Then I went to. It was a consent form for high-risk surgery. Then I said, doctor never told me that it is a high-risk surgery. And if it is a high-risk surgery, why should I get it done for my wife just for hernia? Let her live with hernia. I would not subject her to a high-risk surgical procedure. Then the sister's plan replied, "Aap sign nahi karoge to tar operation nahi ho jayega." Then I said, let that be. I don't care whether you do her operation or not. Tell your doctor that I am not signing this for high-risk surgery. He has never explained. Right? This is one of the places in Delhi where most of our teachers, the All India Institute professors practice. After their retirement, who are not very commercial, they go and work in this place. I am not telling you the name of this place. Then she called up the surgeon at night. Then this time, the another consent paper comes to me. This time, our teachers, the All India Institute professors practice. After their retirement, who are not very commercial, they go and work in this place. I am not telling you the name of this place. Then she called up the surgeon at night. Then this time, the another consent paper comes to me. This time, it's a normal consent paper. right? That's how we practice medicine. This is my personal experience. I run 3 hospitals. I know the strength and weakness of the system. I am not running away from it. But I can appreciate the system. So, there is a system error. There is a systemic error in healthcare. We need to rectify it. Then only we get reflection and respect from the community. It's not a bad profession. It's not a bad profession. You can still get knowledge. So, history is the first thing. Informed consent was not taken properly. Then third cause is informed refusal was not recorded properly. Means I advise him something, you say no. I asked him for a CT scan, he did not do it. I asked him to do this investigation, he did not do it. I asked him to take so and so's opinion, he did not take it. Do we record it? Do we take a signature for him? We don't do it. Refusal consent also needs to be taken. That's one of the third most common cause of medical malpractice suits. And fourth, you know why? Improper records. We don't have the recording system. The basic fundamentals of medicine that we were taught when we were students, that listen to the patient. We don't listen. Examine the patient. We are not thorough in clinical examination. We forget. Many times patients comes, straight away we go to the CT scan or MRI before doing critical examination. A good doctor cannot be replaced by CT scan and MRI. We must all remember. These are all complementary, but it cannot replace a doctor. We must all understand. It's not so. We do not examine this. We do not explain why a CT scan should be done. I still remember how medicine was taught when I was a student in medical college. Take this. That's all. Buy this. No explanation why I should do this. I was not explained what operation was done for my wife. Why that needs to be done. What will happen to her if I don't do the operation. The surgeon never dared to tell me. And next day you know what happened. She went to the operation theatre. Till 11 o'clock I don't know about my wife. I thought he will come in the morning and tell me. He did not. Next morning, up to 11 o'clock, she went to the operation theatre. Up to 11 o'clock, I don't know about her. Then I had some colleague working in the hospital. And I said, what happened, Dr. Borah? I said, my wife went to the OT. I don't know what happened. I'm a little worried. It should not have taken so much time. That is okay. Then he called up OT. He said, okay, she is in the recovery room. Then I went to the, he sent me to the recovery room. He was also a professor in the Institute of Medical Science. So I went to the recovery room and I found, and she was well attended to, not that she was neglected. Then there was an anesthetist who was standing by my side. And as soon as he saw me, he grabbed me. Then I said, why did you come? I said, she's my wife. Oh, he was giving anesthesia. He does not know he's giving anesthesia to his closest friend's wife. This is communication in our medical profession. We work in an environment like that. We work in an academic setting. This keeps on happening in my hospital, in everybody's hospital. No one is exception to it. We need to correct it. If we think that press should not be angry with us, if we think that media should not be hostile to us, if we think that society should respect us, why? We should not. Before I close, I'll tell you. My approach to life has been, which I'm not going to say. Are the patients always right? The honest answer is no. They are not right. But irrespective of who is right, they need to be treated with kindness and care, which I say, I stick to it, I believe in it, and I quote it. That's number one. Number two, treat your patient as God. He will reciprocate you also as his or her God. Then your relationship between a service provider and a consumer becomes a heavenly or godly relationship. All those good qualities of life and human being has not disappeared. Totally. Take care. If there is a heaven I don't know, I have to reach that heaven and reach that through service to my patient. not show anything else. I don't pray personally. I don't go to any temple. I never. But I feel that the way to heaven for a doctor is through my case, through my service. And if you see that, people are still wondering. Look at the sun. You know how many medical errors happens here? I am telling you that 300 medical errors per day. Have they beaten up 300 doctors every day? Have they beaten up, destroyed 300 hospitals every day? No, they are very tolerant up till now. I was asking, it is an unofficial sources, I was asking one of my attorney colleagues, how many medical malpractice suites have been registered in the Assam State Council during last 15 years? He went through the record, it is unofficial. Huh? I don't have any unofficial, he said 50. And another 25 appeal cases from the district consumer court. So, yesterday, where 120,000 medical error, malpractice and negligence keep happening every year. In 15 years, 15 lakhs, more than 15 lakhs, almost 20 lakhs. And of that 20 lakhs incident, 50 people has gone to complain and file malpractice suits. And you know how many punishments up till now in Assam? As per his report, only one has been convicted. So court is still kind to you. Society is still very, very, very violent. Don't become rude to them. Don't criticize them. We are also at fault. I am a part of the profession. I want them. I want my children to pursue the same wish I was doing. But they should do it in a safe environment. In an environment of harmony, in an environment of love and affection, honesty and integrity. I want those things to come back to this profession. Thank you very much. Thank you.